This morning, we're shedding a light on post-traumatic stress disorder in honor of PTSD Awareness Month. Dr. Jason Bombard, a psychiatrist with Aspirus Ironwood, tells us what PTSD is. Jason?
Most people have experienced some form of trauma at some point in their lives. In fact, statistics say about 50% of people will experience some form of significant trauma. And when we do experience trauma, it's very common for us to have some period of time afterwards where it's difficult for us to deal with it, whether we're having nightmares about it, kind of flashbacks or persistent memories of it, or potentially avoiding situations that remind us of the situation that occurred. That's pretty common. What is not common, and what we refer to as PTSD, is when that lasts for an extended period of time. After about a month or so, if you're still having symptoms like that, then that's what we consider to be PTSD. One of the real problems with PTSD is we can't predict who is going to get PTSD based on a certain event. Two people could experience exactly the same thing. One of them may develop PTSD and one of them may not.
What steps can people with PTSD take to help themselves?
The first thing and the most important thing is admitting that this is not okay, that this is something that really does need more than just yourself to fix. Going to talk to your primary care physician is probably a good first step. Therapy is also very helpful. Availability sometimes can be a little bit difficult, but we are getting better with online therapies and things like that. But reaching out and saying it's not okay to feel this way anymore is a big part of it. And I think we all sometimes have the tendency to not look for help when we need it because we think we need to fix this ourselves. But there are some things we just can't. And we have really found in years of research that PTSD affects the brain biologically. There are actually changes in the structure of the brain that occur with PTSD. And those things are not things that you can just wish away or, try to ignore. They're things that really need help.
If loved ones notice something is wrong, what can they do?
I think it's very crucial to talk to them, and talk to them from a position of, caring and saying, I'm worried about you. I can see that you're suffering and I don't want you to feel this way anymore. And I want to help you to get help. It's okay to need somebody.
Can medications be beneficial as well?
Medications can be very helpful as part of that process. Also, one of the things that we've found with most mental health issues is that therapy works well, medications work well, but the combination of medications and therapy works really well. And a lot of times what the medications can do is help to reduce some of the symptoms that the people are experiencing. So therefore, then they are able to do the therapy. One part of doing therapy for PTSD that can sometimes be very difficult for people is a lot of times it involves talking about the trauma that occurred. And if you're in a state of what we call fight or flight because you're so anxious discussing the trauma, you may not get much out of the therapy. So sometimes the medications can actually help to bring down some of that anxiety and let you be able to absorb the therapy a little bit better.
Are there signs to look out for, or is it different for everyone going through this?
I wish it was really easy to know for sure. And, part of my background has been working in the military for a while too. And that was one of the things that we always wished we could figure out, how can we know? And sometimes it is very difficult. I would say that it is important for anybody who experiences trauma to talk to somebody relatively soon. I think we can prevent a lot of PTSD from occurring if you do get in and discuss some of the things that have happened. That being said, the old approach of doing debriefings has kind of been found to not be all that effective. It is actually better to do more of a cognitive-based therapy or something of that nature. It is also really important to feel safe after an event like that has occurred, making sure that you don't just go somewhere by yourself and dwell on it and think about it. Getting back to your day-to-day activities, being around people that matter to you is a good way to prevent some of this.
Is there anything else you'd like to add, Jason?
I think the most important thing to know is experiencing PTSD is not in any way a sign of mental weakness or cowardice or anything like that. Some of the bravest people I've ever met have gone through some very serious problems with PTSD. It really is not a failing on your part. It is something that is biological, just like if you were in an accident and lost a limb, you can't just walk it off. That's not something that you can do. It is a physical change that has occurred, and that's not something that you should feel ashamed of, and it's not something you should avoid getting help for. And the sooner you do get help, the sooner you can get back to living your life and experiencing things the way you want to again.
Thank you, Jason. Stay with us, and we'll be right back after the break.